Well, welcome, folks. Dr. Charles Parker here, and we are very pleased today to have another guest from Sovereign Health, and they have some very interesting programs over at Sovereign Health. And today, what's going to happen is Helen Kienzle, Dr. Helen Kienzle, is going to talk to us about some programs that they have down at Sovereign that have to do with the Men's Prime program for men over 40. It's a dual diagnosis program. So, welcome aboard, Helen. We look forward to talking to you.
Thank you.
So I'm going to introduce Helen a little bit, and then we'll get started, warmed up. Helen is the program director for both the dual diagnosis and mental health programs at the Sovereign Health Facility in Palm Desert, California. For those of you who don't know, that are not in the business, who are innocent listeners out there in your car going home, dual diagnosis means mental health issues as well as substance abuse issues. Now, it can be other types of dual diagnosis. It doesn't have to be substance abuse, but it's a situation where there are a couple of different, what we call in our business, comorbid diagnosis. Terrible word, morbid, but they exist together, and you have to really think about the complexity of the human being if you're doing any kind of dual diagnosis work, and that's what Helen's going to bring to the table as we talk about it. She received her master's degree and her PhD in clinical psychology from the School of Professional Psychology at Alliant University in beautiful downtown Los Angeles, California. Her experience includes clinical internships at the Los Angeles County Department of Mental Health and the Behavioral Health Center at Alhambra Hospital. In her career, she also completed a doctoral thesis on the social support needs of women diagnosed with breast cancer. We're going to talk about breast cancer, folks. Following the completion of her doctoral work, Dr. Kienzle, I'm going to say it right, focuses on providing individual therapy to patients and families, those in psychiatric crisis, and the resolution of those crisis situations, including the development and implementation, if I can spit it out, of group therapy program training. So she works with groups, and I'm going to tell you, folks, I've had my experience. I was originally trained as a psychoanalyst, spent 7 years training psychoanalysis. I was a slow learner, and I got it together and went out and began running down here in Norfolk, Virginia, actually at Portsmouth Naval Regional Hospital, the psychiatric group for psychiatric residents who are in residency in Portsmouth at the Naval Hospital. That was a trip because I was so used to working with individuals. And these young men, it was just a delightful opportunity for me to work with them in a group. So we'll talk about three things. We're going to talk about that Men's Prime program, we're going to talk about breast cancer, and we're going to talk about the difference between individual and group therapy and counseling. So, Helen, what brings you to the table here? How did you take this turn to be involved with Sovereign Health and these different programs?
That's a very good question. As you very nicely put it, my training has been mostly in the Los Angeles metropolitan area. I've worked at the Department of Mental Health and inpatient psych hospitals. However, I moved out to Palm Desert about 3 years ago, and the first thing I realized was the beauty of the desert. And the second thing I realized was that the desert was all about recovery. And there were multiple treatment centers that I found intriguing, that offered individual therapy, group therapy, just the recovery field in the desert is huge.
It is. I didn't realize that. You mean, now where is that located? You said Palm Desert.
Yes.
And where is that related to LA? Is that south of LA? Is it down near Palm Springs?
Well, it's close to Palm Springs. We're about 15 minutes away from Palm Springs.
Oh yeah. Okay.
So it tends to get very hot here in the summertime. Mm-hmm. However, it's also very therapeutic. Mm-hmm. The scenery, the air, the atmosphere is perfect and ideal for those seeking recovery and treatment. And I started to do a little bit of soul searching and job searching, and I came across Sovereign Health. And I realized that their philosophy and their mission aligned well with my own. And everything just kind of came together from that point on. And I applied and grew within the company. And I've been here for 3 years now. And I absolutely love it.
So how did your philosophies align? What was your philosophy? What was their philosophy? And how did you come together in that regard?
That's a great question. When treating addiction, you have to also look at the mental health issues. And the first thing you want to do is understand where the mental health issues are stemming from. Is the individual treating the mental health difficulties by using a substance, or is it the other way around? Meaning, is the substance use causing significant impairment? To treat one, you have to treat the other, and they go hand in hand. It's like peeling an onion. There are many layers to mental health. There are many layers to substance use as well, but in order to tap into the core issues, you have to be able to look at both the substance use disorder, the drug of choice, and the mental health component as well.
I completely agree with you. That sounds great. So, and what kind of comorbidity do you see in your programs? Like, for example, let's talk a little bit about the Men's Prime program. It sounds quite unique. We just interviewed Dr. Suzanne Drury, who's with Sovereign Health, on the Women's Trauma program, and that's the episode 100. It's 4 episodes before this one here. But it was really great because they have a women's program. How does it work with a men's program? Why do you have separate the men out, and why is the Prime program different than an ordinary treatment program?
Sure. The reason we did that was because we started to track trends with our admissions. And we realized that in our regular dual diagnosis program, we had a very significantly large volume of men who were over the age of 40. Now also, the desert, the Coachella Valley is also very well known for retirement communities as well. We have many men and women who are here, who reside here over the age of 40. We also have what we call the snowbirds, men and women who travel from the north during the winter months and spend the winter here. And we realize that a lot of our existing population was over the age of 40. So we kind of put our heads together, and when great minds come together, we came up with this wonderful program for men specifically, because at the time our population was, we had more men than women. And the program that we designed is based on Erikson's stages of development, and there's a stepwise progression in the curriculum that we designed. So to be more specific, we looked at men's issues, men who are struggling with retirement or loss of a job or difficulties maintaining employment, challenges that they're having in their relationships. They're either going through a divorce or they're trying to work out their marriage, or wife has left the husband, so on and so forth. So we really pinpointed significant issues that men over the age of 40 were struggling with. And we tied that in very nicely with the curriculum that we designed. We also introduced coping skills and tools that men can gain from completing the program, and be able to use that once they go back into, independent living, back into the real world, once they're done with treatment.
So a lot of what you're saying, pardon me for interrupting for just a second, but one of the things that occurs to me, I'm going to put my professional hat on for a moment, because so often we're talking about substance abuse and the admixture of relationship issues into and with substance abuse. The word codependency does come up. And, I'm going to tell you so that we don't have any kind of misunderstanding. I mean, I don't know where you are with codependency, but I wrote a book back in '92 called Deep Recovery, How to Use Your Most Difficult Relationships to Find Out Who You Are. And that relationship, I mean, the book was on relationships and recovery as it related to relationships. Because I think it's one of the main things that is not done effectively in most recovery programs. So where are you, without putting you on the spot, what's your thought about recovery, relationships, and the word codependency? The phrase, the concept.
Sure. You put it very nicely, and I agree with you. What we've found is they go hand in hand. You really have to understand the issues around codependency. I'll give you an example. Many of our patients struggle in treatment because their family members support their behaviors. And what I mean by support is, a patient will contact a mother or their father and say, I need $100 under my name in my account. And they end up using those funds inappropriately. So the family is supporting that behavior. And until they stop doing that, until they stop helping the patient who's in treatment, until they, sever ties with respect to that codependent relationship where one is relying on the other and one's behaviors are dependent on the others, the patient is not, it's going to be challenging for the patient to completely recover and gain or reap the benefits of treatment, if that makes sense.
Absolutely. So important and clear boundaries need to be set on a person like that. And I think a really important aspect of this is not only emotional boundaries, so regarding people being hurt and sensitive and issues like that, but also cognitive boundaries, because in my experience with the codependency issue, so many people are actually cognitively dependent and not at all emotionally dependent. They rely on other people to do their thinking for them. They're not emotionally tied up with them as much as they are cognitively. Of course, if that cognitive dependency is abrogated in some way, broken down, the emotional, they become emotionally disconcerted because they don't have that cognitive input to actually run their lives. They haven't figured out how to live their lives in the first place, and they need somebody to tell them what to do. Two issues. I mean, there is emotional codependence, but I think there's also cognitive dependence as well.
Absolutely, and we see a lot of that as well. Just to give you another example, we often have patients who don't want to be in treatment. And we understand that. Being in treatment, being in an environment that's unfamiliar, away from loved ones and your support system may be very challenging. However, they can call their family member and ask for a flight home. Should I stay in treatment? Well, the individual needs to make that decision, and the family needs to help them make that decision on their own. But we run into that issue too often where the patient, the client, is seeking cognitive support and is cognitively dependent on another family member. And again, it goes back to what I said earlier. Until there are clear boundaries established, it's going to be challenging for that client to benefit from the program and to benefit from treatment.
So are there women in that program, even though it's a men's program, or what? Do they actually have it separated as they do and Sovereign in other women's programs? Do they separate the sexes?
Yes, our programs here are not co-ed, they're gender specific, and we offer a regular men's DD program and the women's DD program as well. Specifically with Prime, that too is gender specific. And what I mean by that is currently Prime is only for men, and Power, which will be launching tomorrow, we're very excited for, will be for women over the age of 40. And the structure and the curriculum will be similar to Prime. However, it will be around women's issues.
Yeah, you said DD, just to make sure the audience knows that's dual diagnosis.
That's correct.
So you were saying DD is the inside word for dual diagnosis. So you got a dual diagnosis program, and you've broken it down not only in gender specifics, but in age as well.
Correct.
So what's the issue then that you would say, staying with the concept of the Men's Prime program, and you were talking about Erickson's stages of development, what are the things that you see happen? First of all, how long is the program? What are the things you see happen sequentially in your program? I've done a lot of inpatient work myself, and I have some ideas about it, but I'd be interested in your observations.
To answer your first question, the program is between 45 and 90 days.
Okay.
And what happens first sequentially, most men will go through detox. The detox process can be challenging for many, as they have an extensive history of substance use. And detox can last anywhere from 3 to 21 days, depending on the substance that they're detoxing from. Once they've completed step 1, then we transition them to our residential program, where they are required to attend groups and participate in individual therapy sessions. They meet with their case managers. Some of the challenges we see, usually men in the Prime program are highly motivated. This is sort of like their last chance in making things right. So they embrace this opportunity, and like I said, they show motivation to get better and to make things right with their family members. And many of them come in with strained relationships, so this gives them an opportunity to work things through family sessions and family therapy. But that's where it starts. They go through the detox process, they go through initial challenges and difficulties, transitioning them into residential programming, where they are part of the community here. And helping them get involved in the community gives them an opportunity to see what life can be like again. So many of our patients, our men, have been disengaged from reality because of the chronic substance use. So helping them transition to the community by giving them tools and resources is our second step.
So what are those tools that you give them? What kind of things do you do then in that transition that you prepare them for leaving?
First and foremost, we give them an opportunity to work on their step work. We're not 12-step based. However, most clients will choose a 12-step based program, or Celebrate Recovery, or a non-12-step, depending on what their choice is, what their preference is. Luckily, in the Coachella Valley, we have many options available, many meetings throughout the day, every day, so we're not limited there. And we have the Salton Sea, which is very desolate, but it's a perfect location just for time to reflect on life and where they're going from here on out. Moving forward, what do these men want to do with the rest of their lives? Some of them are, in their 40s, some are in their 50s, 60s, 70s. Where do they want to be 5 years from now, 10 years from now? Just giving them that opportunity for self-reflection is very important for them, because some of them haven't had that chance.
Yeah, they don't know who they are. They've never recognized who they were because they found themselves in a relationship, whether it's cognitive dependence or whatever you want to call it. They never explored themselves. Their identity was their job. Their identity was their relationship. And then when they have the recovery, what really happens is all that artifice is stripped from them. They have to actually deal with who they are as a person, and that reality then becomes that's the only way they can recover. If they don't have that, that's part of where the inventory comes in the 12-step program. You've got to get an idea of who you are and where you want to go and what you want to do. How does the Salton
Yes.
Sea fit into that, Helen? What you mentioned the Salton Sea. I have this semi-romantic picture of the desert in a very barren lake with a lot of salt in it. How does all that fit into recovery?
Well, we offer several therapeutic outing options. Joshua Tree is one location we often take clients to. Salton Sea is another. But just hearing clients express their experience with the Salton Sea is fascinating. It is desolate and it is very salty. It's very peaceful, and there isn't much. However, looking at it from a different perspective, you can see that for many, it gives them a chance to see where their lives were headed and where they can be going, and correcting certain behaviors and correcting some of their actions and repairing certain relationships is key for them. Just the tranquility of the Salton Sea provides that space for them.
Sounds very interesting. So then I know Sovereign is so good. We've heard it from the chief all the way down to a number of different individuals in Sovereign, because one of the things I like about Sovereign is we completely agree with the way they think about things. I mean, the idea of doing a quality job, using an effective community, and really planning very, very specifically, programmatically for transition into the real world is characteristic of what they do. I mean, it's the way it should be done. There's no question about it. The other thing I want to ask, though, is as we go through it, we've kind of heard about the transition, those of the listeners who've been with me, so I'm not going to ask you to talk about that. I want to segue while we have a minute to leave the Salton Sea for a moment. I'm kind of out there. Do they have pelicans in the Salton Sea?
Every now and then you might see one.
I was thinking about it. I just trying to imagine what was actually going on out there. But the next question I wanted to do is tap your brain on this other topic which was important to you, and that was the breast cancer topic. We want to get as much out of this interview with you as we can, and we're looking for different angles of things that we really need to know about to move on down the line productively. So what did you learn about breast cancer that you didn't really fully understand going into it before you became involved in your research?
The one thing that really caught my attention, first I want to mention that the reason I went into breast cancer research was because of personal reasons. My cousin was diagnosed with stage 4 cancer, which led me into my own research. And this was a perfect opportunity for me to learn so much about a world that I was completely oblivious to. And the one thing I realized, among others, was that we have limited information and not many preventative measures. Many of the women that I worked with who were diagnosed with breast cancer often had screenings done once a year, twice a year, once every 2 years. And even that alone wasn't enough to catch this disease growing in their bodies early on to prevent a metastasis from occurring. So I emphasize the importance of growing and expanding our knowledge on cancer. And I'm hopeful that one day screening tools will be available to intervene at a time where time that's going to be sufficient to treat it accordingly. Unfortunately, for many women, it's too late. Even, being diagnosed at stage 2 or 3, it's advanced, and the outcome.
Let me interrupt you for just a second, because you're saying some things. It's clear that you're passionate about this, but I want to make sure that our listeners, and I want to interrupt you because as you're telling the story, many people don't know what the stages are and how that plays and what your knowledge is about the stages and why is one worse than the other and so on.
How would you like me to elaborate?
Let me ask you the question. I didn't ask you well enough, but what's stage 1 and what's stage 4? Let's really just talk about those. We don't need to go to the nuances of it,
Sure.
Because you're not a medical person. But what is stage 1? How does that present? And that would be an important place to start. And then we go to stage 4, and we just get an idea of the spectrum of breast cancer and different things that could be done once some of this basic understanding takes place.
Stage 1 would be early detection versus stage 4 would be advanced cancer.
Okay. With metastasis.
Yes.
Okay, so stage 1 is like a lump in your breast.
Exactly.
And you don't know what it is.
Yes.
And it has to be differentiated from fibrocystic breast disease, for example.
Exactly.
And a lot of these people who have breast cancer do suffer from premorbid, before the breast cancer occurred, estrogen dominance. They had problems with their periods. They've had issues going on for years. They perhaps were on birth control for a long period of time and packed estrogen on top of estrogen. And those who are estrogen sensitive could have a variety of different cancers, and breast cancer being one of them, ovarian cancer, cervical cancer. And stage 1 is like, let's pay attention to the possibility and the premorbid conditions that could contribute to breast cancer. Does that make sense?
Exactly. Yes.
So then what did you find in your research? Was it that did you have a tool by which people could know about this, or what were your conclusions about this challenging problem?
My research was interview based, and what I found was that women had not only emotional support needs, but social and instrumental support needs as well. And what I mean by that is they needed a friend or a family member to talk to. They needed a support group. They needed women who shared similar experiences. That's the social support component. Mm-hmm. Emotional support was a huge factor in recovery. And what I mean by emotional support is, again, someone to hear them, someone to cry with, someone to support them through a difficult transition, and instrumental support, driving women to their appointments, helping them get from point A to point B, staying with them while they're receiving treatment, information, things of that nature.
Did you find, this is a curiosity, I didn't really even think about this as a problem. Thank goodness it hasn't been in my family, but I think the listener would be interested to know, what is your conclusion about partners, male partners, the husbands? And yes, there may be a women's support group with individuals who are suffering with similar maladies, but what was your finding regarding the husband's position with the woman's challenging condition?
That's an interesting question. I found that some men needed support themselves, whereas some men were the sole providers of support. So it could go both ways. A lot of it has to do with the man's experience with a medical condition himself. Mm-hmm. Some men had another family member diagnosed with breast cancer and therefore have been through the process and are familiar with what to expect next and what the next step may be. Whereas men who didn't have as much knowledge or experience would seek support themselves, were in support groups, were participating in family therapy sessions, so on and so forth. So the findings showed both were a possibility, that men would either seek support for themselves or support their wives or their loved ones through the recovery process.
Well, Helen, there's the title of your next book, girl. Men taking care of their wives through breast cancer. That would, I think that what my experience is with guys is they're in profound denial about psychiatric problems, mental problems, and medical problems. It's sort of like we're all out here warrior dudes, and if you're in the warrior club and we're killing mastodons together, you don't whine, you don't talk about problems, you just go out there and kill mastodons. You don't, and if you whine too much, we're just going to kill you because you're going to interfere with mastodon killing, And that is what I've seen frequently with guys when they come in, because it's so difficult for them to seek mental health in the first place or look at things from an emotionally based problem. And so I think that would be something that would be very instructive to really have for individuals to use with their loved ones.
Yes.
All right, so I won't put you on the spot about breast cancer anymore. We really, there is a problem. I'm so glad you can share that with us, because there's a certain measure of denial there, is kind of what you're saying, and we don't have the structure. Women are by themselves, they're alone. So they have this life-threatening malady, they're terrified, and they don't have a system. And what you're saying is our system needs to create a system to more appropriately, just like they do at Sovereign Health, more appropriately deal with the structure of their recovery process. And if they don't have a structure, their likelihood of recovery is far less.
Absolutely.
Well, that brings us down, because you did mention the word group, and I was listening for that because I was thinking about my final question. We only have a limited amount of time left, but please tell our listeners what your experience is between the difference between individual work and group work. What's your finding about that? How does that work in your program? Any thoughts you have about the differences there? Because honestly, I'm going to tell you right now, so many people do not want to do group work. One of the things that would come up with a residential, and you know this because you work in residential treatment, they want to be private even though they're in residential treatment. They don't want to come into a group and talk about their things. Honestly, one of the aspects of recovery is the ongoing support of a community in a group process. But people are very uncomfortable with the possibility that the group could get out of hand and that somebody there is going to attack them in a group situation. That's been my experience.
And you're absolutely right, and that has been a huge challenge and continues to be a huge challenge for us. Some clients will prefer individual therapy over group therapy. There are many reasons. For example, those who have a history of trauma have difficulty sharing in a large group setting, even in a small group setting, because it makes them feel vulnerable and exposed. Mm-hmm. And this can apply for both men and for women. Sometimes clients with a history of aggression have difficulty staying focused in a group setting as well. And these difficulties can be huge barriers to recovery. And we have to work with the client and help them work through these challenges themselves, and remind them that there are benefits with group therapy. Just hearing about the experiences of other men and women can be healing in and of itself. And what some clients don't realize is that they're not alone. Many other individuals share common experiences or similar experiences as them. And it's so important for our clients to hear that they are not alone in their addiction and in their mental health.
So true. Now, listen, I'm going to put you on the spot a little bit because I'm kind of identifying with my listeners and thinking about this because these are all valuable pieces of information. We've talked about the specific men's program, about women's program as a side. We've talked about the whole issue of dual diagnosis, and we talked about breast cancer. We've talked about a number of different issues. But this is the kind of put you on the spot thing, because all of us are interested in learning. And I think we learn from individuals. I know I can learn from you, even though I'm a little bit older than you are, and and I've had different experiences than you have. I'm sure I can learn something from you, and in that regard, I know our listeners can. Take a moment to think about for a minute the most difficult and challenging experience you had in working with somebody that you managed to pull together in some way that would be a learning experience for you, where you said, hey, this is very interesting. I was approaching it this way, and this person was telling me this and telling me that, and I had this other idea about how to approach it, and it worked out successfully. So I learned from that experience. Do you have anything that comes to mind in that regard?
The first example that comes to mind is an experience I had with an actively psychotic patient. This individual was experiencing auditory and visual hallucinations and had difficulty maintaining eye contact, and we were concerned, and I was concerned about his safety. And what I realized in that moment was I have to make sure that I get the attention of this individual in order to prevent harm from occurring.
So
harm
he was
to
thinking
self.
about harming himself? Was he talking about suicide?
Yes.
Okay.
And in that moment, I realized that I have to consider his overall presentation, not just what I'm seeing or not just what he's reporting, but all these pieces come into play, and I found that I have to act quickly, think quickly, and use all the tools and the knowledge that I've gained throughout the years to keep this individual safe. Mm-hmm. Working with psychotic patients, those in active psychosis, can be very, very challenging, especially when they don't hear what you're saying because they're responding to internal stimuli. So just working through that moment and taking it one step at a time by also keeping the patient safe is the key to a successful intervention.
So what did you actually do then?
Well, we had the patient in a room, and I kept talking to him, made sure that he was able to hear my voice, and we were able to call the ambulance and the police, and he was assessed and transported safely to the hospital on a 5150 hold, on a psychiatric hold.
So you weren't in the hospital when this was going on. You were out in the community.
Yes.
And then when you say, what's a 5150 hold? We're not from California.
It's an involuntary hold because an individual can pose a risk to himself or to others, or may be gravely disabled and unable to take care of, activities of daily living. And
so the challenge for you was having a working relationship with that person, even though they couldn't have a relationship because they were psychotic, and keeping that relationship going until structure arrived in the form of police, the authorities, somebody to actually hold him in a way and get him in a safe place that they could actually transport him, getting in a facility where he was safe, and properly medicate him and protect him.
Exactly.
So were there any tricks that you used?
No, I can't say they're tricks, but staying with the client in that moment is the most important thing. Okay. And also being aware of your environment, because there's so many other factors that come into play. For example, an individual can run in the street and get hit by a car. So you have to make sure that the environment is somewhat safe, and he or she is not going to get hurt while you're trying to do this intervention and call for support and assistance and whatnot. So I don't have many tricks, but
Well, one that was occurring to me, and I was assuming you might have done it, and then I would formalize it by suggesting it to you, would be to get into the delusion with the person and actually be a part of it, even though it's irrational, because then you could connect with them in that irrationality, and they would see that as a rational, positive connection that you could then perhaps manipulate them to manage themselves better. Did you try anything like that?
Yes, because I found that going against and arguing against the delusions are challenging,
Mm-hmm.
and that can lead to aggressive behavior, hostility, so on and so forth. And so you're right. Agreeing with the patient and meeting them where they're at is key. And working in the psych hospital, that's one intervention that we've been trained to use over and over, and it's shown to be, successful.
Definitely works. Well,
Yes.
Helen Kienzle, thank you so much for taking the time with us. Some interesting pearls of wisdom from a person who's in the street, dealing with individuals on an everyday basis with a whole variety of different thoughtful intervention systems for people on many different levels, from a dual diagnosis to breast cancer to psychotic individuals. You've been around in a short period of time. You've really developed some interesting ideas that sounded like they were helpful.
Thank you.
So listen, what would you say in closing that you would like our listeners to do? Is there anything specific that you think, hey, this is a book, this is a website, we know about Sovereign Health, that's going to be in the show notes? Is there something that's kind of a treasured book, thoughtful PDF, or anything you would share that you would say, hey guys, you got to get into this?
The one thing that I want to leave our listeners with is, you can try to convince and talk someone into seeking treatment, whether it's for addiction, whether it's for mental health. It doesn't matter. The individual must be motivated himself or herself to seek treatment and to get better.
Mm-hmm.
It's challenging when you're working with a client who doesn't want to be in treatment and doesn't want to receive help. So please keep that in mind. It plays such a huge role in the recovery process if the individual is just not ready.
Mm-hmm. So yeah, sometimes it works that way. It definitely is frustrating in that regard. Well, listen, we got to run. I really appreciate you taking the time. We talked about a variety of different things, and it's fun to really get into to talk to a person, really get into some different subjects that we ordinarily don't cover, and have some new pieces of wisdom come our way. So, thank you very much, Helen, and I look forward to talking to you sometime in the future.
Thank you.